If you are dealing with arthritis in your hip and now your knee is starting to ache too, you're not imagining things. There's a growing body of research showing that hip arthritis and knee arthritis are often connected. One can directly impact the other. Let's break it down. How are the hips and the knees connected? Your hip and knee joints are part of a kinetic chain. They work together with the pelvis, the lower back, and the ankle to keep you upright, walking, and moving efficiently. When the hip motion is restricted due to arthritis, your body will adapt, and this compensation changes the way your knee absorbs forces and moves during everyday activities such as walking, sitting, and climbing stairs. Over time, this extra strain can lead to wear and tear on the knee joint, and eventually osteoarthritis happens. What does the research show? Multiple research studies have looked at the biomechanical relationship between the hip and the knee joints, especially in context with arthritis. Here's some key findings. A 2020 study on osteoarthritis and cartilage found that hip arthritis altered knee joint loading patterns, increasing the risk of inner knee arthritis. A study from a journal of biomechanics revealed that individual hip arthritis showed altered gait mechanics, including increased forces at the knee joint. A Mayo Clinic reviewed also observed patients that had hip replacements due to arthritis were at a higher risk of developing symptomatic knee arthritis within the next few years, even if they did not have significant symptoms beforehand. So let's take a deep dive into why this is happening and what you can do about it to stop this cycle. So when we do a deep dive into what is actually really going on, the first phase of it is when you start having some joint tightness in the hip, joint mobility issues that can start from the pre-phases of arthritis, that alters the way our body works. So let me explain a little bit more. So let's just explain this as if this is the leg bone and our kneecap glides through here and our muscles in the hip attach through here. What happens is when you don't have the full mobility, you can't get your muscles to fire correctly. It just doesn't happen, because if it does, it's going to hurt. And so it's your body's mechanism to kind of just shut off. And so when that happens, our hip muscles actually help control the rotation in that leg bone. And so if you don't have the mobility and then you don't have the strength, then what happens is you get more rotation. And when you get more rotation, it actually puts stress on the inside of this joint and of the knee joint. And when that happens and you do that repetitively over time, it starts wearing out that knee joint because of the biomechanics of how everything is working together. And so you can see how everything in our body is really connected. And if we don't have enough mobility in that hip, then those muscles won't fire correctly. So that's the first thing that is a problem. The second thing is because they don't fire correctly, we get a lot of glute weakness, and our glutes are what stabilize not only the hip joint, but also the knee joint. Because remember that mobility, it helps with that rotation. Every time we're bending, we get rotation that happens. But if we have weakness, what happens is it'll really rotate, causing the knees to kind of look more like knock knees. And then that creates stress on the joint that it's not supposed to be in that position. And so it's really, really important that the glute strengthening that needs to happen, it's probably the number one thing that we see in our clients when we are addressing their whole body and we're looking at what's going on. The glutes are the biggest problem. I mean, once we get everything moving, it takes a while to get those glutes to fire because they haven't fired in a while. And so literally we have to do things to almost like jump start that muscle to get it to start working, and then eventually work on doing more functional activities that will get those muscles to fire. So when all those things happen, then you get an impaired gait because things hurt. We tend to shift our weight to the side. We kind of use it, kind of what I call it, like a peg leg. So you just shift your weight to go and do things. And as you're doing this, your body is taking different weights that it's not normally supposed to be taking as you're doing your normal walking cycle. And this happens all the time. So people look like they're Humpty Dumpty because they can't actually get their glute muscles to fire. Their hip doesn't move very well to where they can actually move the hip forward, because they're going around it by shifting the weight laterally so that they can get the leg to come through. And so these are all things that impair the gait cycle that also will affect the knee because of things that are going on in the hip. So what can you do to stop this? The biggest things you're going to do. I'm going to give you 5 things. So the first thing is improving the hip mobility. We have to improve that. And a lot of times we can. Even if we improve it by a little bit, the gains that you get are huge. I mean, we see this all the time in our office. And so there's certain things, because our joints have patterns that we're going in all the time, there's usually one joint stretch that we can give that's going to open up the joint. And when that happens, then all of a sudden we're able to get the muscles to start firing. But usually it takes us understanding the body a little bit, figuring it out, because the hip joint moves a lot. Like, it moves in a lot of different directions. And so the normal direction that we typically move into for improving that mobility is actually moving into extension, hip extension. Most people will go in and they're just going to be stretching like this. They're stretching the joint like this for the hip because of all the tightness that's happening. And in reality, those are probably making it worse. Because great, yeah, you're stretching the muscle, but it's the joint that we need to get to open up so that those muscles will release so that we can actually get things to kind of fire again and things to kind of move. So a lot of times we take the joint into hip extension, such as this, where you're just lying here and you're just arching and really stretching this joint and kind of holding it to really like get everything to kind of move. And so that's typically the direction that we go into. There's other directions that we do. There's other ways to progress the forces, but we have to get that mobility. And a lot of times when we improve that mobility, the functional gains that we get are huge. Okay, so number 2, the second most crucial thing then, after we get the mobility and we start improving that, we've got to get those glutes to start firing. And the glutes are the hardest thing. Like, what works for one person does not work for the next person. And so we've got to really find exercises where you actually feel that glute activation. Because if you don't feel it, then things aren't firing. And then what happens is we, again, compensate by shifting our weight over because we can't get those glutes to activate. We start using our quads, which also affects the knee because we can't get those glutes to activate. Glute activation is key. And as we get older, it just gets so weak because of all the compensation that we do. So the glute activation not only supports a healthy joint in the hip, but also supports a healthy joint in the knee. So make sure you're doing exercises that you can actually feel those muscles. Okay, so the next one is poor recruitment. So again, we talked about like how we can't recruit some muscles and we start compensating. The big compensation patterns are shifting our weight to the outside. It makes us use these muscles, which also makes us use that IT band. So that's how we get some lateral knee pain a lot of times. But also when these don't fire, we'll also get some quad pain, which will give us pain in the front. We also will get pain on the inside of our knee. Everyone's a little bit different on what we see. Those are all compensations that we have to stop. So even if we get things stronger, you're just going to be used to going into those compensation patterns that we have to break that cycle. And I often say this, like, you'll have someone that had surgery, let's say they had knee surgery, and from the surgery they've been limping. And then all of a sudden, they're feeling better, we're able to do a lot more, but they walk out the door and they're still limping. And you're like, why are you limping? Like, I'm not limping. And they're like, yes, yes, you are. You're totally limping. Like, oh my God, I didn't even know. Because they have the habit, they didn't even realize they're doing it. Their body is so adapted to doing that we have to break that cycle. So sometimes with people, we have to break the cycle of them compensating, and that just takes some time with us doing certain exercises and functional exercises to help you stop the cycle of using the wrong muscles at the wrong time. Okay, number 4, we have got to reduce the inflammation and the tissue joint tissue irritation as well as the joint irritation. And the biggest things we can definitely do that with physical therapy and helping you reduce some of that inflammation. But the biggest thing that we have at our office is actually using shockwave technology. It's a regenerative type technology that we can actually take shockwave, go through the joints of the hip to start repairing any kind of damage that's happening in that joint. It actually will revascularize the bone tissue as well as tissues around it, so that when a lot of times when things become arthritic, it's because they lost the blood supply. The body, was trying to heal. It stopped healing. It said, we're done. And all of a sudden you have this tissue that you can't do anything with, or this joint that you can't do anything with. Well, we can actually revitalize all those tissues, revitalize that bone to help reduce that inflammation really quickly, but also to help heal any tissue that has been damaged. It's a game changer for our office. We're one of the few people in DFW that actually have this technology. So if you're wanting to learn more about that, definitely make sure you look into the comment section to learn more on that. Okay, the fifth thing, see a specialist. I cannot tell you how important it is to find someone that understands the body like our office, because we can help you get there faster. Videos are great, but you can't see the whole picture. You're so close to it that you can't see like, well, maybe that's it, or maybe this is it, and you start Googling stuff, and all of a sudden you have cancer. I mean, I'm exaggerating, but I'm really not exaggerating, because I literally had conversations with a patient recently, and they're like, oh my God, my body's falling apart. I think I have cancer. I need to go get all these tests. And I'm like, no, you just have hip pain. You have a little bit of back pain. We can totally resolve this. This is definitely mechanical. So when you can get to someone that understands the body, you're going to get there much faster, and we're going to be able to guide you through that process much easier. That's going to be specific to you. So they are worth their weight in gold when you can find someone that's really good, because they're going to help you, like our office, avoid surgery, avoid injections, avoid medications, avoid going to seeing, you know, a PT and then a chiropractor and then an acupuncture, and you're not getting results because you have to have someone that can spend time with you to peel the layers back to figure out what is going on with you and how to address your situation specifically. So if you like what you're hearing, make sure you subscribe to our channel. We put out content all the time to kind of help you understand the body and navigating what you can and can't do, as well as share this with someone that needs to hear this message. This is a great video, as well as a lot of our other ones. So if you have any questions, make sure you go into the comment section and ask us, and we'll be there to kind of help guide you as much as we can. See you later.